Could selfies provide health insights? Next. Over the last 2 decades, the selfie has gone from pixelated flip phone image to polished social media post. And the modern-day self-portrait is about to get even more up close and personal.
I'm getting a live feed of your vitals. I can see your systolic, diastolic blood pressure as we speak.
Enter Anora, a health selfie app developed by Toronto-based medtech startup Neurologics.
What we are trying to do at Neurologics is to bridge the gap between lab-based clinical equipment and the general public.
Think of the traditional ways that we would have to get that information. You'd have to go to your doctor, get the test, follow up later. We can simplify that workflow.
We're a multidisciplinary engineering company, so we've brought lots of disciplines of medicine and biology and physics and machine learning research together to create something quite unique.
Using a video camera and good lighting, Levy says Anora can measure about 30 different health indications from a 30-second selfie.
What's so radical about what we're doing is it's non-contact. Our sample comes from the camera and it's a virtual extraction of your blood flow. We started with heart rate, breathing. These were relatively simple for us in the early days. And then we migrated to blood pressure, cardiovascular disease risks, your triglycerides, your cholesterol.
How can a selfie measure all of these parameters? Dr. Thompson says the idea is similar to how pulse oximeters work. Anora uses transdermal optical imaging, or TOI, a technology that uses light to capture facial blood flow through a video camera. This data is sent to their cloud-based effective AI models for processing. Results are then displayed back in the app in just a few seconds.
For over 7.5 years now, we've been training models. We have an extensive collection of human samples that we've used as our ground truth. What I mean by this is we use medically approved and regulated equipment, and we establish that as our baseline.
Neurologics has 17 patents and several clinical studies backing its accuracy, though the app is currently for investigational use only and is not yet FDA approved.
The next step in our product roadmap is a telehealth product, and it provides even more capabilities.
So over the next 2 minutes, there'll be a scan. We'll let this run, and it'll do some analysis, not only for your vitals, but we'll see some other parameters come up. I'm a family doctor. It's been really interesting to see how technology has evolved and allowed us to interact with our patients where they are, moving the encounter really to the patient's home. So this is a summary of that 2-minute scan. Your blood pressure is amazing. You're not at risk for heart disease or stroke. It's a game changer, really, on how telemedicine will be in the future.
Dr. Thompson says this is not meant to replace doctors, rather complement them.
We're still going to need that personal relationship. We always want our technology to be under that directive control of a physician or a healthcare provider. It's going to be hard for my colleagues, I'll be honest, because I think as AI moves into what I do as a primary care clinician, I can fight it tooth and nail, or I can recognize that it can help me do a much better job than I can by myself.
The technology has also faced hesitancy on the consumer side.
People look at our technology and I think sometimes, oh, it's a video, you've kept the video. No, it's pixelated images of blood flow.
Our software will break that video down within your app and extract the facial blood flow material, and it just sends that material.
3 decades from now, this will just be like my stethoscope for interacting with my patients and simplifying how I can engage with them.
We've just scratched the surface right now with what we can do.
While the future of wellness looks to be largely tech-focused, the health benefits of the great outdoors will never be replaced. I'm Rahel Solomon. We'll be back next month with a glimpse into what entertainment might be like in 2050.